Let's talk about eye care with facial palsy, in my case, Ramsay-Hunt syndrome. This is one of the biggest issues that I've had to deal with. When I first had my facial paralysis, the eye not being able to blink was really problematic. I found myself closing it manually to blink it. If I'd go outside, it would dry out instantaneously. So I started out with eye patches, but the problem I had was I can close my eye. I'm now 4 months in. I can close my eye and it will stay closed. Like I could take a nap like this and it'd be okay. But the minute I open my good eye, this eye wants to open as well. So the best thing that I got was a moisture chamber. Now I'm going to link in Amazon. This is where I got them. The first one I got was this dark moisture chamber because I could get it really quickly. Now this one looks cooler. Kind of looks like you're a pirate. It's a little bit. Oh, it's a little bit smaller. I haven't worn this for a while. It's also nice because it's got the shade, and not being able to blink makes it hard in the sun. So I would say this is good if you're going outside in the sun or you want to use glasses with a clear moisture chamber. Now, here's the problem with this dark one using it all the time. I found that I was starting to develop double vision. My vision was getting kind of crazy. So I moved away from this one on a daily basis. And I now wear this clear moisture chamber. This one's also a little bit bigger. I think you can get them sized up. And this is a game changer. My eye doctor says, hey, this has been one of the best things I could do. Now, in addition to this, I use eye drops. You want to use the preservative-free ones. And initially, I was putting the eye drops in, very regularly. Now, with the combination of the moisture chamber and a procedure I don't have to put them in that often. I got what's called a punctal plug, which plugs up the tear duct. And that has done a really good job of keeping my eye extra moist without having to put the artificial drops. The other thing is at night, I will use these drops. I'll also use this gel. I'll put the link from Amazon for these. So I'll moisten it and then I'll put the gel, which keeps it a little bit more moist. Although if I use it during the day, I can't see as well. And then I tape the eye shut. The way that I tape my eye, I initially taped it vertically, and then I read some stuff and watched some videos and said it's actually better to do it horizontally. So I'm going to give my best attempt to tape the eye on video. Let's talk about tape. I use this paper-based tape. There's a lot of different tapes. There's some that have more adhesive, that have latex, whatever. I found this to be the least irritating for the skin. So just pay attention to that because you're going to have to do this every night for who knows how long. So I will, after I've put the drops in and put the gel in, I'll close my eye. I will usually tape the upper lid. So make sure that I've got the whole lid. Then I'll try and pinch the lower lid and then I'll close it like that. And that usually does a pretty good job. Like I've opened my other eye, it's not opening up. But usually I try and keep the other eye closed so there's not the mirroring effect. And just to kind of protect my eyes, I'll wear an eye mask. So this is how I sleep. Kind of crazy. If I have to get up in the night to use the bathroom, which I've always had kind of a need to go to the bathroom in the middle of the night. I navigate without vision. So having a bathroom that's really accessible has been really important to me. That's what's worked for me. There's probably other things. I have had my doctor talk about with the eyelid getting a gold weight to weight down the eyelid. I have been okay with the moisture chamber. It is weird. Hey, the whole face is paralyzed, so I might as well send a signal. And my eye doctor said this has worked really well. And he said if he didn't see as much health in my eye, we probably want to look at more procedures because there are some other things you can do, like get your eye sewn shut. Sounds pretty messed up. I have developed, and it's probably good that I'm doing this video a little bit later. You will see that almost 4 months in, I have a droop in my eye. My eye doctor says that's normal. Looks weird. He says when the eye comes back online, it should tighten up. So I do have a droop, and I am curious with my next checkup. I do feel like I'm getting a little bit more redness. Maybe that's just it's summertime and I've been going outside more, doing more stuff. But that's what I use. That's what I use for my eye care. Take good care of your eye. Don't want to lose it as a part of this facial paralysis. So take good care of your eye because hopefully the face comes back online. And when it does, your eye will still be there to see the things it needs to see.